Hey everyone, and welcome to Chef AJ Live. I'm your host, Chef AJ, and this is where I introduce you to amazing people like you who are doing great things in the world that I think you should know about. Well, my guest today was referred by a previous guest who happened to be his wife, who is also a medical doctor. His name is Curtis Rimmerman. He works at the Cleveland Clinic, and he's going to be talking about healthcare professionals in nutrition, why the gap must be closed. Please welcome Dr. Rimmerman, the second Dr. Rimmerman, in fact, to the show. Nice to meet you.
Well, thank you. It's my honor and privilege to be here.
So Cleveland Clinic is very well renowned. I've had a couple of your doctors on the show. I've had Dr. Esselstyn several times. I've had Dr. Roizen several times. So, I always hear it's always in the top 3 of places to go in the United States. Is that not correct?
Well, I think we're actually officially a top 4 hospital if you look at U.S. News and World Report. Yes.
That's pretty good. So, and you practice cardiology there?
I do. And as a matter of fact, we've been the #1 ranked heart and vascular program for the past 28 years throughout the United States.
I'd love to hear about that because I'm sure because we mentioned before we went on that you do personally follow a plant-based diet. So I'm guessing you're probably familiar with Kim Williams, a former president of the American College of Cardiology. And I'm wondering how, as a practicing cardiologist, you feel about a quote I once heard him say: "There are only 2 types of cardiologists, vegan and those who have not read the data."
Wow, that's a pretty strong statement, but I'm not sure that would be 100% popular amongst all cardiologists, because I think we have a ways to improve in terms of compliance, even amongst physicians, in optimizing their health and particularly their food plan. But I fully agree with that statement. It's pretty much an all or none, and I think those of us who are particularly patient-facing, irrespective of your medical discipline, following a healthy lifestyle, of which obviously a plant-based food plan is one significant core component, is extremely important.
I've told this story before on the show. I remember, God, it was over 20 years ago. I was working as an activity director as a retirement home, and one of my colleagues was admitted to the emergency room with chest pain, all kinds of symptoms. And so he was there for a long time. They were doing all kinds of tests, and they concluded that he either had had a heart attack or had diabetes, or both. But while he was waiting for the results, they fed him, they brought him dinner because it was dinner time. It was beef stew, a piece of white bread with butter, a carton of milk, and a piece of apple pie. Now, how are they serving that to patients waiting to see if they have diabetes or a heart attack?
Fully agree with you 100%. And certainly we can do better. And I think the medical profession actually has done better in that regard. If you were at least at the Cleveland Clinic, we have paid a significant amount of attention to this, but not all of our patients are going to accept a plant-based food plan in the hospital. I think we have to also, while we advocate for it, we have to be respectful of their personal choice as well. So, but we do limit the choices to some degree, prioritizing a more healthy food plan, recognizing it may not be fully plant-based.
Okay, so let's play devil's advocate here. I'm not saying that hospitals, because even Adventist hospitals, even though they don't serve meat in the cafeteria, will give it to patients. But why do they have to serve crap? That's what I'm saying. Like, if you go to a hospital, I don't know about the Cleveland Clinic, but I know the hospitals that I volunteer at, there's vending machines with like Cheetos and Coke and all those kind of things. So why is crap allowed at the hospital?
Fully agree with that. Let me try to answer your question as best as possible, recognizing I don't set the food plan here at the Cleveland Clinic. If I did, it would look a lot different. But the bottom line is, at least at the Cleveland Clinic, we were one of the first hospitals to get rid of smoking on our premises. So that's where we had to pay attention to the basics. Then our former CEO, Dr. Toby Cosgrove, had the idea of getting rid of all sugary drinks on our campus, and that is gone. He inherited a McDonald's on our campus. That was a 20-year lease. We got out of that as well. So we do have a much more healthy orientation toward food. But in terms of your audience today and being fully plant-based, we have a ways to go. But clearly the medical profession and hospitals in general are moving in a positive direction, but it's not at the pace that any of us would like to see.
Great. Is it true Dr. Roizen said that more people complained about getting rid of the sugar than the smoking?
I don't know. I didn't take a poll on that. I trust Mike in his chief wellness days probably did. But I think there were vociferous opponents to both, to be honest with you.
So tell me what it's like. I'm assuming you have probably a cafeteria. What do they offer? Some healthy choices there now?
I'll be honest with you. I haven't been down to the cafeteria probably in 20 years, so I have no idea.
Well,
I bring my own food, so
oh,
I don't go down there.
then I'm curious what you bring.
Well, it depends. Sometimes that's a great question. I just had a bag of peppers today, a few bananas. Maybe not completely compliant, but I had an Ezekiel sandwich with some crushed almonds and a little bit of spreadable fruit, and then I had some dates.
Well, that sounds like healthy whole food to me.
Okay, well, good.
Yeah, I mean, you look trim, you look healthy. When did you first adopt a plant-based diet and why? Was it after you became a cardiologist and started practicing? And then, I mean, how did you
Well,
hear about it?
I'm really glad you asked that question because this was my wife and I turned the switch from not plant-based to plant-based on one day. And we did this on our anniversary back in May of 2015. And it was her decision to do that. And, you know, I call marriage a team sport. So she really, really wanted to go plant-based. And I said, absolutely, let's do it. And I think it's one of the best decisions I ever made. From a professional perspective, why did I do it? One, I want to be credible to my patients. If I'm going to advocate for plant-based, I need to be plant-based myself. The second reason is I've been practicing cardiology. This June will be 30 years as a cardiologist here at the clinic. And yes, time does go by quickly, but you might say, well, why did it take them 23 years? Well, I didn't have the educational background. I didn't have the knowledge. Of course, I knew Dr. Usselson quite well over the years. I didn't feel that the research was where it needed to be as impactful, maybe to make that decision. But the bottom line is, one, I'm concerned about my own health. Two, I'm want to be credible to my patients. And three, I'm tired of sending patients for stents, bypass surgery, other avoidable illnesses, when in fact, at this point in my career, I want to try to get in on the front end of the disease, not the back end. The front end is a much more exciting prospect. While we may be impacting the business proposition of hospitals, less procedures, being on the front end makes a huge difference to patients, particularly when you can catch them younger, when they're in a position to impact the next 30, 40, 50 years of their life with their decisions. So that's the exciting part for me, and that's why I pivoted personally and why I have pivoted professionally.
So that's fantastic. Did you notice any difference in the way you look or felt after going plant-based?
Frankly, how I felt, probably not, which surprised me a little bit. How I looked, just less subjective body fat, a couple inches around the waist. So really, I think I trimmed up a bit. But other than that, and then obviously my lab numbers as well. While my cholesterol was never high, it became much lower.
That's fantastic. So how do you talk to patients, or do you talk to patients? And are patients just seeing you because you're a renowned cardiologist, or some of them seeking you out because you are plant-based? Because, you know, there are websites where you can put your name that you're plant-based.
So I'm not very good at self-promotion, to be honest with you. I'm more of whoever wants to come and see me is welcome to see me. Keep in mind, here at the Cleveland Clinic, we're physician-led, and we are on a salary, us physicians. So, and we're on a yearly salary. So we're not really incentivized by volume. We're instead incentivized by quality and outcomes for our patients. So I think it's a very ethical way to practice medicine. With that being said, really, it's a new learning proposition to understand how to talk about food with patients. And I must say, I've learned along the way over the past number of years, and I've nuanced my conversation, and I also assess who I'm talking to, what their level of understanding may be, and how receptive they are to the conversation. What I learned initially, Chef AJ, was I was presenting it as an all or none proposition, and that's probably not the way to go. An all or none proposition can be really overwhelming to patients to make that switch like I did in one day. Not everyone is capable of doing that. Some people have to ease into these lifestyle decisions, which not only impact them, but impact their families and their social network. So some patients are receptive to 100% I'm all in. Others will say, maybe I'll focus on breakfast first. Maybe I'll focus on breakfast and lunch, and then maybe I'll work towards dinner. So we bite off smaller chunks at a time, and I give them some experience and some help some perspective that I've accrued over time, maybe tackling what I eat for breakfast, for instance, and then they can start extending that to lunch. And dinner seems to be the hardest meal for the patients, but it has been so gratifying, to be honest with you, that when I had a husband and wife come in, one was the patient, one was the spouse. And I walk in the room and all they said was 60. I go, what do you mean 60? And they said, I lost 30 pounds and my husband or wife lost 30 pounds. And this was over a period of several months. As we know, it's not just about weight loss, because you can lose weight in either a healthy or an unhealthy way. But they did it the right way. I often cite Dr. Greger's book, How Not to Die. That was a very pivotal book for me. While some of his studies don't have a lot of patients, I personally believe he's got the passion. He's definitely, it's not in it for him. He really wants to change the world, as you do, as people like I do. And I found that to be a very readable book. And what I tell my patients, I try not to give them too many resources because it can be overwhelming. I do recommend his resource. I tell them I have no financial relationship with that, number one. I tell them I want you to read it like a textbook, not like a novel. Get out a pad of paper, get out a highlighter, take notes, treat it like a class. If you follow what he recommends, and then by extension, you will follow some of his references, you will be making one of the best decisions of your life. And that often is the launching point for my conversation. Then I start sharing some of my personal experience. Let me say this as well. It is a challenge for us physicians to figure out how to do this and do it right. And what do I mean by that? There's a time limitation to what we do. I'm supposed to be seeing a patient, and I'm given a finite amount of time. It's sometimes hard to weave in nutrition as well into that time frame. So we do the best we can. And excuse me, I've prioritized nutrition, but sometimes it requires several visits to cover everything.
Yeah, that's true. I mean, that's why some people go into like lifestyle medicine, where the appointments are just so much longer.
Exactly. And, you know, we have a set standard appointment length here. And that's the way it is. But sometimes it's just it's a series of appointments, but we'll see the patients back if we need to.
That's great. Now, we talked, you brought your lunch to work, which means you're not interacting probably with your colleagues at lunch. So have you been able to influence any other cardiologists or any other colleagues about being either plant-based or just taking nutrition more into their practice?
Well, I've had some sidebar conversations, to be honest with you, but I don't get up on a pedestal and preach. And, you know, it's a personal decision. I think I'm quite certain my colleagues are aware of the value of eating more plants and less animal products, but these are educated professionals. And sometimes where the discussions take place in the hallway are because they've inherited some of my patients. If I'm out of town and they're providing cross coverage, and almost in every patient, my recommendations include a whole food plant-based program, no oil, no processed food, and no refined sugar. That's kind of a phrase that I put in the note. Our patients get their notes so they can see it. And then my colleagues might see, we cross cover on patients sometimes, and they'll see that. So that's what generates the conversations, is when they see that repetitively in my notes.
That's very cool. I love that. Have you ever talked to Dr. Roizen about diet? Because his is pretty good, but he just really is in love with his salmon and olive oil.
You're absolutely correct. So I know Mike very well. I really, really respect the guy. We've traveled together. We've spent days together. He brings an almost superhuman amount of energy to every day. And I've been in a gym with him. I've been on a treadmill and he's been on an elliptical. And I've never seen someone exercise with the intensity that he does. And I'm not going to say that it's not just for his age or not his age. Even a young man, he's all out in what he does. And he tells me he will not go to sleep without 10,000 steps a day either. So he's just an incredible person, but you're absolutely right. He does eat salmon. We don't sit and debate it. But you know, if everyone could be on Mike Roizen's food plan, this world would be in much better shape.
Oh, it'd be much better on his than on what they're eating now.
Exactly.
Absolutely, 100%. Yeah, yeah, yeah. I had him speak at one of my conferences. He's kind of like the Energizer Bunny, isn't he?
He's actually a phenomenal colleague, and there's probably no better expert in terms of the wellness space than Mike Roizen, and he's been doing this a long time, and he looks so young, and he acts so young, and he brings such passion to his work, and he's not tired of working.
Yeah.
It's an incredible combination, actually.
Yeah, I like him very much. Do you hang out with Essie in the family?
Well, I can't say we're best friends, but I can tell you that we are. You may or may not remember this, but we lived close by. We could walk to each other's house, and his grandchildren and our daughter, swam together. They're incredible athletes, the whole family. As you know, he's a gold medalist way back, I think, in 1956. But I think, to be honest, like many others, that family, and particularly Dr. Essie, the inspiration, I think, for our family going plant-based, if I was to say one person or one family, that would be it.
Did you ever go by their house Halloween to see what they were giving out?
No, I did not. Maybe I'll put that on the bucket list for next year.
Or just do you have a child or a grandchild so you can kind of like?
Well, I don't have a grandchild, and our daughter is 27, so I don't think she's going trick-or-treating. So we're kind of in between.
Maybe you can hire a neighborhood kid. Since you are a real cardiologist or a real medical doctor, when we send out who's going to be on the show, so people sometimes write in, would you mind answering one question from a viewer?
Any question. I can't guarantee I have all the answers, but I'll try.
Right. And of course, if they're too personal or too medical, but people could see you, right? I know you say you're not good at self-promotion, but I'm sure you have like people working with you at the office, and this really isn't self-promotion to just go to a website like plantdocs.org and just put your name on it. It's not really self-promotion, because what that does is because there are a lot of people, especially my viewers, that would prefer to go to a doctor of any specialty that is plant-based themselves. And it just enables people to find that specialty in that area. You know what I'm saying?
No, I fully respect that. Thank you for that tip.
Yeah. And I know I've been communicating with Cindy, and I can tell her that if you're too busy.
Please, either or is fine.
Yeah.
I have no problem doing that.
And maybe I can just put in the show notes that you do it, because a lot of the doctors don't accept patients. And I mean, I know that people would like to see a plant-based cardiologist, especially this lady. I'm not sure where she lives, but her name is Jean. And she said that please pose this question to Dr. Rimmerman. What can you suggest to reduce the shortness of breath in a mostly SOS-free vegan senior citizen that Kaiser attributed to mild heart failure and reduced capacity of lungs due to abdominal bloating plus kyphosis, scoliosis from vertebral fractures? So it sounds like mild heart failure. That's something you probably deal with.
Sure.
She's an 80-year-old. She takes 20 milligrams Lasix, wears compression hose for mild lymphedema in the lower legs. She does have a little bit of sugar and salt in commercial. Oh, she's having sardines. Why is she having sardines? That's not.
You'd have to. I'm not sure I can answer that one, but let me say this: in listening to her story, it's always difficult making a diagnosis or recommendations over the phone or secondhand without seeing the patient. But what I'm impressed with is the fact that she's short of breath and she's kyphotic, and she should probably have pulmonary function testing to make sure that she does not have reduced lung capacity, in particular something called restrictive lung disease. And the other question I have for her is, how was the congestive heart failure diagnosed? Was it diagnosed clinically? Was there evidence of fluid on a chest x-ray? Did she have an echocardiogram, and was her heart function reduced? So there's a lot more questions and answers here, but based on what I'm hearing from her, she should see a pulmonologist to see how much of this is heart versus lungs. She may want to see if there's any pulmonary type of, for lack of a better word, physical therapy or breathing exercises that the pulmonologist may recommend. And frankly, she needs to take a personal assessment. Is her level of fitness? I realize she's 80, but isn't 80 the new 50, if I'm not mistaken? So she should make sure that she's getting, to the best of her ability, some sort of aerobic activity daily, if she's capable of doing that, because a body in motion stays in motion, as I'm sure some other people have probably said on this show. You got to use it or you lose it. So It's very, very important. Then there's one other thing called a pro-BNP test. It's a blood test, brain natriuretic peptide. She could have that drawn in her blood, and that is a very sensitive and specific marker for congestive heart failure. So that's a blood test for congestive heart failure as well.
Well, great. Thank you. That is fantastic. Sure. Live viewer named Apple is asking if sauna bathing is beneficial for cardiovascular health.
I'm not aware of any study that has looked at that, to be honest with you. The only thing I would say is a couple of things. If you are exposed to extreme heat, and particularly, I'm thinking of a hot tub, which is not sauna bathing. I don't even know what sauna bathing is, to be honest. But if you're exposed to extreme heat in a hot tub, you have to be very careful because the blood vessels in your periphery dilate. The blood rushes to your skin, and that's why you become tachycardic, meaning you have a very rapid heartbeat, because your core organs are actually volume depleted because the blood is dispersed to the skin. And if you have underlying heart disease, for instance, prolonged high temperature dehydration can be very, very stressful on the cardiovascular system.
Thanks. Now please feel that you don't have to answer questions, especially.
Oh, I don't mind. Whatever you want to do.
This one is on cancer though, so I don't know if that.
I'm not sure. I might be the wrong person, but give it a try.
Okay, sure. Thank you. I said that, you're a cardiologist, but Brenda said, can you speak to breast cancer biopsy? I've had breast cancer biopsied. Hubby is concerned I need surgery right away now that the tumor has been punctured.
Okay. So let me put an asterisk on this that I'm not an oncologist. I'm not a breast surgeon. But obviously the results of the biopsy are most important. And if the biopsy is positive for cancer, then there's something called staging, because then they have to decide, is the cancer localized or has it spread? If it's spread locally, regionally, or widespread. So there's two, one, I'm not qualified to answer, and two, there are too many unknowns for me to precisely answer that question.
Right. Thank you. Okay. Well, this one I think you're going to be able to answer. It's about blood pressure. And Cindy says, what is the ideal blood pressure for an adult? It used to be 120/80. Is it recommended now that it should be lower?
Not necessarily. I think 120/80 is normal, in my opinion. Obviously, if you run lower than that, that's not a bad thing, as long as it's not too low and that you're having symptoms of what we call cerebral hypoperfusion, where you actually become dizzy upon standing from a low blood flow to the head and the brain. So, but 120/80 is a blood pressure that everyone should shoot for.
Terrific. You talked about, you were recommending that the 80-year-old make sure she gets, exercise, aerobic activity. What do you do for exercise? Do you have time? Because I remember when I've interviewed Dr. Royce, and he's like Dr. Greger, he's on the treadmill while he's doing interviews.
So as you can see, I'm sitting down. I do not have a treadmill desk. I would find that I very, very difficult to concentrate, to be honest with you. So, Mike is very unique, I think, in that regard. But for me, I'm more of a treadmill guy, and I'm not an Olympian, but I strive to exercise at least 30 minutes a day aerobically. When I strive every day, I typically hit, I'd say, between 5 and 6 days a week. And I've also started incorporating some resistance training as well. Not as much as I'd like, but have recently restarted that. I used to do a rowing machine. I have a Concept 2. Between my wife and I, we have basically every machine that you can imagine. The Concept 2, which is a rowing machine, I don't know if you're familiar with it. It's one of the best exercises out there, I think. And I really want to pick that up again. When I bought it probably 10 to 15 years ago, it was about $900. It's probably the best investment in terms of investment return for the cost of any exercise machine I've ever gotten. And, it's important to have the right technique. But in talking to Dr. Esselstyn, who won the gold medal in rowing, it exercises almost every muscle in the body, plus obviously the cardiovascular system. So that is something that I think is one, if you can master it, it's one of the ideal forms of exercise.
Wow, I know that. So I've never done. So that's mostly for the upper body, the rowing?
No, it's lower. You actually kick out first. So you start with the legs, and then you pull out. So I'm not here to promote Concept 2. It's the only one that I have experience with. and I think it's a company in Vermont. I have no financial relationship with them, but I've just had a very, very good experience with that piece of equipment.
Because I know that my husband, it's his birthday today. He doesn't do any exercise anymore. And I have a spin bike, but he chooses not to use it. But I know he used to love rowing machines. That could be a great gift for him.
And also it's a total body workout, upper and lower.
Wow.
And aerobic. So if you're looking for exercise efficiency, that is a great way to do it.
Okay. See, I get so much out of this show because every show I learned something that I wouldn't have known if I hadn't done it. So thank you. And I wrote down that one. I might have to talk to you about that. This is because I didn't get him anything because said he didn't want anything, but I'm going to get him one of this. We have space for it.
Okay, good.
Okay. Thank you. So Cindy, who's watching live, would like to know, are PVCs problematic? And because not everybody's a doctor, maybe just explain what a PVC is.
So PVC stands for premature ventricular contraction. And that is an early or premature heartbeat from the bottom of the heart. So it really depends on why are you having PVCs. Sometimes it's related to stress, lack of sleep, or caffeine, or alcohol. Those are the main issues. However, they can also occur in patients who have underlying heart disease, such as high blood pressure, valvular heart disease, or coronary disease. So it's a very non-specific finding. It is typically not anything to be concerned about, and it often improves or resolves with lifestyle modification. However, it could also be a clue for underlying heart disease in a minority of circumstances, and therefore, if they don't go away with lifestyle modification, then it is important to discuss this with your physician. And oftentimes they will do an EKG to start with. Remember, an EKG is only 10 seconds of your life. So you may not even see a premature heartbeat in 10 seconds. So they may apply a 24-hour Holter monitor, which is the size of a small transistor radio, if we're old enough to remember what those are, and with a couple wires on the chest, and it allows us to assess your heart rhythm over a period of 24 hours. So single premature complexes are not a concern. When they're strung together into a longer string, that is something called ventricular tachycardia. That's very concerning. But that's not what we're talking about today. We're talking about PVCs.
Great. Thank you. You mentioned caffeine and alcohol. I mean, people say they're good for the heart. Are they really?
Caffeine, it's almost like red wine. It depends on what month of the year it is and what study you're looking at. I'm going to quote my 96-year-old father, everything in moderation. And there's something to be said for that. I personally drink decaffeinated products. That's my preference. I like the taste of coffee, but I don't necessarily like the chemicals. With regard to alcohol, I'm not sure I have scientific proof of this, AJ, but I will tell you this. It's my feeling alcohol, for the most part, is a toxin.
Thank you.
I'm not a believer in alcohol.
I love it.
On a personal level, I've maybe one drink a month or something, 1 to 2 max. But even that I'm steering away from lately because I just don't like how it makes me feel. And when it makes you feel tired and you lose your mental capabilities, how can that be good? So
you don't have to convince me. I know. I never drank. I always thought it was just made people stupid. I never saw any benefit to drinking alcohol.
One of the things I think about alcohol is there's a little bit of a social bonding about it. You might say, well, you can bond over water, you can bond over plant-based food, but there is something about the atmosphere that alcohol, even as one glass of wine, it creates an ambiance that people like. So I'm not here to say you shouldn't drink, but I do think drinking should be the exception, not the rule, and it should be within a reasonable limit. Probably not more than 1 to 2 at a time or at a setting. But I'm not an expert to tell you what's right or what's wrong. I'm just sharing with you my experience and what I do. And as I get older, I'm drifting further and further away from it.
Great. Well, thank you. Let's see. Here's a question from Rebecca. At what age would you recommend people have a calcium scan and how often after that?
So this is controversial. Number one, any calcium scan involves radiation exposure. So you need to decide as an individual if you want to be exposed to radiation. And you may say, well, it's probably not that much radiation, but you have to think about the cumulative medical testing in your lifetime. And let's say you're 40 or 50 years old, chances are you're going to have the need at some point for X-ray imaging, CT, these sorts of things down the road as you get older and health concerns arise. So in my view, you never want to electively expose yourself to a radiation-based procedure if you don't need it. So I'm actually not a big proponent of calcium scanning. I am a big proponent of a very healthy lifestyle, stabilizing your plaque, making sure your lipid parameters are normal, not smoking and not exercising. And if you do have a significant positive family history, or if you have symptoms that are concerning possibly for coronary artery obstruction, do a test called at least an exercise EKG. And if you want to actually improve the diagnostic utility of that, consider a test called an exercise echocardiogram. And I don't know if anyone on your show has ever discussed an exercise echocardiogram before, but if you don't mind, let me take a minute or two to discuss this. An echocardiogram is an ultrasound of your heart. It's like an ultrasound of the baby, but we take it up to the heart. Except for a little jelly on the chest, it's completely harmless. Ultrasound has never been proven to be harmful to the body at all. You feel a little pressure where they put the probe, but otherwise there's no discomfort with the test at all. The echocardiogram shows us the overall heart function, shows us the valve function, tells us if there's any fluid around the heart. It's one of these very high yield, low risk tests. And whenever you want to have a test in medicine, you want a high return of information and low risk. Now, so we do an echo, then we put the patient on the treadmill and they exercise to their best ability. Immediately after the treadmill stops, they hop back on a table quickly without a recovery, and we do another echo. If the heart is contracting like this, very vigorously at a heart rate of 150, the likelihood of flow limiting blockage to the heart is very low because oxygen is getting to the muscle and the muscle can continue to sustain itself. With flow limiting blockage, what we will see is one or more areas of the heart will look very sluggish because that area of the heart is not getting the proper amount of oxygen at a heart rate of 150 and it cannot sustain its function. So in experienced heart centers, not just the Cleveland Clinic, but many across the country, an echocardiogram with stress, in my opinion, is the preferred test to assess for the presence or absence of coronary artery disease, instead of using a calcium score and instead of using nuclear stress testing.
Wow, that test sounds kind of fun. I mean, I know I don't have coronary artery disease because once I was in a really bad car accident, for some reason, I don't know, they did some CAT scan or something, and they said, and I was like in my 50s, they said they saw nothing. Like,
okay, good.
So, but it sounds like a fun test,
Yes.
I mean, as far as tests go. All right. So Susanna says, does Dr. Rimmerman have any suggestions of what to do for a 29-year-old male experiencing high triglycerides, no family history, and he is not eating a plant-based diet?
Okay. So one would be to transition to a lower carbohydrate plant-based food plan. So clearly carbohydrates, including refined sugars, need to be eliminated or minimized to a significant degree. This individual may in fact have a familial form or a hereditary form of hypertriglyceridemia. In my view, this is pretty important, particularly at age 29, because they're supposed to be on this planet for at least another 50 plus years. If that's the case, this needs to be addressed sooner than later. One, through lifestyle modification with their food plan. But secondly, they should see what we call a lipid expert. And there are, in larger heart programs across the country, there actually are lipidologists or lipid experts who will see you and perform the appropriate testing for you. And it would be important to do that test fasting as well for triglycerides. Cholesterol is a little less sensitive to fasting, meaning you don't have to absolutely fast for cholesterol, but for triglyceride, very important to fast.
Wow. I never heard of, is the lipid expert, what's their specialty? Like, are they cardiologists first or?
Not necessarily. They could be a cardiologist, they could be internal medicine, or they could be endocrinology. And then the other thing would be for this 29-year-old, I trust this individual doesn't have diabetes. That's another cause for hypertriglyceridemia. The other would be a thyroid disorder. So really seeing someone who's either a very experienced internal medicine physician or a lipid expert would be the way to go. And a broader blood panel is indicated in this circumstance.
Great, thank you. Okay, here's a question on omega-3 fatty acids from Susan. Can you talk about the effect of them from plant sources such as flaxseed, chia seeds, avocado on the heart?
Well, I have to admit, I eat a lot of that stuff, but I'm not necessarily an expert in answering this question other than, yes, we think there's positive benefits. I can't tell you exactly that there's a one-to-one benefit, but in those patients who have adopted a food plan that incorporates that type of those components in their food plan, obviously it's going to be extremely beneficial, not only in terms of their vascular health and what Dr. Esselstyn calls creating that endothelial fortress. I assume you've heard him say that before, but also in terms of proper weight and body mass index, and therefore very positive benefits in terms of blood pressure. So no negatives there, all positives.
Great, thanks. Okay, Florence says, I'm 70 years old. I'm whole food plant exclusive, no SOS, and sometimes my blood pressure spikes up. Is this okay, or is this indicative of an underlying issues? I take no meds whatsoever, just vitamin B12.
So thank you for that. And yes, the importance of taking vitamin B12 is definitely, don't want to ignore that on this type of food plan. But with regard to blood pressure, how I look at it is our blood pressure is not a straight line. Okay, it responds to a multitude of inputs, of which emotions can play a significant role. So I would ask the questioner, are they particularly stressed when this is happening? Can they identify a recurrent theme when the blood pressure goes up? Because if they can, then they can maybe create an opportunity to avoid that type of situation in the future. But more importantly, what I tell my patients is sometimes I'll get very detailed, data-driven patients who create graphs of their blood pressure. I don't want to generalize inappropriately here, but sometimes engineers or accountants, they're very quantitative and they're very data-driven. So in my experience, some of these types of patients, engineers, that sort of thing, create these complex graphs of their blood pressure. But I ask them to look, what does your blood pressure look like over 24 hours? What is the blood pressure load on your body over 24 hours? And if you're having an occasional spike, that doesn't bother me very much. What I'm more concerned about is what does your blood pressure look like over time? And what is the average blood pressure? That is the more important determinant of either a normal or well-controlled blood pressure versus one that's not in control.
Great, thanks. Hey, I'm trying to find the rowing machine you recommend. What's it called again?
Concept with the number 2.
Okay, I'll keep looking. Thank you. Here is the most broad question I think we'll ever get from John. It's about, okay, sorry, I just lost it. Come back, little question. Oh, did genes affect your health?
Genes, meaning like G-E-N-E-S?
Yeah.
Not J-E-A-N-S, right?
Yeah, no.
Okay, good. I just wanted to make sure. So absolutely. I mean, fundamentally, each of us should know our family history as best as possible. So if you have 3 generations of early coronary disease in your family, it's even more important for you to be on a plant-based food plan and take some of the risk factors out of the equation. So I personally am very aware of my family history as best I can ascertain, going back a few generations. That in some respect has motivated me to adopt an even healthier lifestyle. And clearly some of these diseases that we're talking about, coronary artery disease, for instance, have a clear hereditary component.
Yeah. But do you like that saying, genetics loads the gun, but diet and lifestyle pulls the trigger?
Yeah, I think that's fair. I'm not sure we can completely neutralize genetics in all cases, but we can really, there can be a formidable battle between our lifestyle and genetics where lifestyle can win out.
Okay. Oh my God, I just found it. It's so expensive, that machine.
Is it really? How much?
It's like $1,600. Do I have
Oh,
is that about right?
yeah, I mean, I'm talking like 15 years ago, it was about 900.
Okay. Wow. Okay. Well, might be worth it. So
But let me tell you this, if your husband was to adopt it, meaning
Yeah.
and really use it,
Yeah.
and then it would be really money well spent, particularly
Yeah.
if you extrapolate over the course of a year, it's about $4 a day.
No, I agree. If he'll use it, that's the operative thing, because it's a very expensive coat rack. If he's not going
Understood.
to use it. Yeah. So,
But maybe you would use it.
well, it's not that I wouldn't. I mean, I kind of am. I may stuck in a
You
rut.
know,
I get on the butt. The first thing I do when I
Here-
wake up is spin for 60 minutes standing up.
Well, let me, what I would do, and again, I'm not promoting this one company because there's other very credible companies out there. This is the company I know about. Go on YouTube and look at a few of them and see, and have him look at it and see if he might consider it. But that's the best way to do it.
He just doesn't have the stick-to-itiveness of me.
I see. But I think for you, diversifying, and
No, and you're right. I don't do anything for my upper body, and people tell me I'm too skinny, but I'm not too skinny. I just don't have. I have a very lean upper body.
We're kind of in the same boat there, and I need to diversify my exercise too. So I don't want to project to your audience that I'm perfect either. I could do better in this regard. But I can tell you this: the rowing machine is a spectacular device.
No, it sounds. I'm not ruling it out for sure.
And as a matter of fact, you've motivated me. I'm going to hop on it when I get home today. And I
All
mean
right,
that.
good. No, because that's when I do other things, is when I'm on the spin bike. I'm like watching a juicy show on Netflix. That's how I treat myself.
Right, but you could still watch the show.
Oh yeah, no, exactly. That's what I'm saying. No, but I have not ruled it out that maybe we'll get
In
one.
the rowing machine, there's different resistance. You can adjust the resistance. So you can, make it easy. I always say this about exercise. You shouldn't be punitive. You should enjoy it. So if you just wear yourself out doing it, then you're not going to come back to it.
Yeah.
So you have to gauge your own ability and work your way up.
Right. But it is important. It's funny because in the time that I've worked with people, it seems like it's much easier to get them to eat properly than to exercise. It's like there's just such a block with people. It's like people either do it or they don't.
So I have an international patient. He was emailing me. He's telling me how fatigued and tired he is. He's not a young man, but he's still a vital individual. And I said, that's exactly why you need to exercise. When you're tired and fatigued, that's your body saying you're less active than you should be, and you need to turn it around. So it's almost counterintuitive, but it actually works. And I know you agree with me on that.
Absolutely. So here's a question from a live viewer about the portfolio diet. She says it's being pushed by her cardiologist. She's concerned about all the fat in the nuts. What do you think of the portfolio diet? And maybe explain what it is, because I've actually never heard of it.
I've never heard of it. So sorry, that's a short answer. I apologize.
So if you can maybe tell us what it is, we can get a future to explain about it. How do you feel about taking supplements on a whole food, plant-based, vegan SOS diet? We did 2 lectures for Dr. McDougall. He's completely against them, except for
so he's going to be way more qualified than me. But what I'm concerned about with these supplements in general is they're really not extensively studied. And we don't know what the manufacturing process is and the oversight. So I think a well-balanced food plan, plant-based whole food with vitamin B12 is the way to go. That's my own feeling.
Thank you. Can diastolic dysfunction get better with a plant-based diet?
In theory, yes. So that's a great question. It's a bit technical, but diastolic dysfunction in broad terms is often seen in patients with longer-standing high blood pressure, where the heart becomes a bit thickened and stiffer over time. So for any volume of blood in the heart, the chamber inside runs a higher blood pressure. So oftentimes reducing blood pressure is the key to improving diastolic dysfunction. And also increased and regular aerobic activity is very important. So it's those 2 things. So weight reduction through increased aerobic activity, but more importantly, a healthy food plan with better choices will, to a large degree, in most circumstances, improve diastolic dysfunction. The other thing, and probably other guests have mentioned this, there's an epidemic of either undiagnosed or underdiagnosed sleep apnea out there. And sleep apnea is something else that drives up blood pressure and can create significant diastolic dysfunction and impact on the heart. So if you do have diastolic dysfunction and it's not explained by elevated blood pressure, then consider sleep apnea and discuss that with your primary care physician as well.
Thank you. Okay. Susanna says, do you have any thoughts on white coat effect? My husband takes his blood pressure at home and it's 125/75, but at the doctor, it's 150/90.
Okay. So this is a very important question. It sounds very basic, but it's very important. First of all, I'm really impressed that her husband is taking his blood pressure at home. That means he cares. Okay. Number two, whenever his machine, I assume it's accurate, but one can't assume that with certainty. So every time he goes to a doctor's visit, he should bring the machine in with him to make sure it corroborates accurately with the equipment in the professional physician's office. In addition, sometimes blood pressure will be slightly higher or lower in one arm versus the other. You always want to use the higher arm. Sometimes when a patient arrives in the office, they're brought back, say, by a nurse or a medical assistant, and they're not given 5 or 10 minutes in solitude to re-equilibrate and from the rushing and the stress of parking their car, coming into the office. And it's that 10 to 15 minutes of just sitting in the office in solitude to wait for the blood pressure to re-equilibrate before the blood pressure is checked. And a high volume medical practice doesn't have the time to have patients sitting around. So oftentimes the blood pressure is more accurate at home than it is in the office, believe it or not. So that's a very, very important point for your audience, that they need, if they have an interest in checking their blood pressure at home, bring their cuff into the office. And also, if it is accurate, then trust the home values more than the office values.
You know, it's interesting. When I used to be a respiratory therapist, like, oh my God, 40 years ago, and we used to take blood pressure, we'd put the sphygmomanometer on and, pump it up and listen with a stethoscope. And now when you go to the doctor, it's the weirdest thing. Tell me if this is accurate. They put this thing on your wrist and they say, go like this. Is that accurate? Because that's what all the doctors here are doing.
I've got close to zero confidence in wrist blood pressures.
So why are they doing that? Because it's like, and if they're not doing the wrist one, they do the one, that's also an automatic one.
I'm fine with the automatic one on the upper arm. I call me old school, call me old, whatever you want to call me. I've been doing this a long time. I've just not adopted the wrist mentality. Maybe some engineers could prove it to me. Otherwise, I've not had that conversation. But we've been, taking blood pressure for over 100 years using the upper arm. Why don't we stick with something that is proven to be accurate? And not necessarily, convenient is not always better, right? Sometimes you have to be a little inconvenient. That takes longer time, but you get better results.
Yeah, I that was so new to me. I
wouldn't trust it. And to be honest with you, if you have a concern about your blood pressure, get your own cuff. Do your research in terms of brands. I have a few brands in my mind, but I don't necessarily, I've already plugged a rowing machine, so I'm not sure I should plug a blood pressure machine.
You didn't really plug it, but don't worry.
I hope not. I'm just sharing personal experience with that.
It's not like you're getting a kickback from
No, I'm not.
So please do not worry about talking about brands. And if you, if you wanted to mention a blood pressure thing, it's perfectly fine.
Okay, well, the Omron brand, I think, is well known out there, OMRON. Sometimes if you read the New York Times, they'll do some reviews of blood pressures as well, or different types of equipment. And I think within the past couple of months, I saw one on the New York Times for blood pressure machines. I like to believe that they're, they have no reason not to do a thorough job. So your viewers may try to look that up as well. But I think, having a home blood pressure machine that is accurate and that is appropriately sized for the arm. I don't have a very big arm, so at a standard would be fine. But if you're a bigger person, it needs to be a larger cuff. And you, again, you just need to take it into your doctor's office to make sure it's accurate.
That's a great idea, by the way. Are you familiar with the brachial artery tourniquet test?
Help me out here if you don't mind. I'm not
And
sure.
Dr. Esselstyn talks about it in his book with Vogel. You know what? Thanks for reminding. This is a great show. You're reminding me a bunch of things. He was supposed to be on the show and he went away. Vogel did the research with the, I guess he gave the patients a neutral meal like cornflakes and the blood flow was great. And then they gave him McDonald's and it was terrible. Okay. And then they gave him olive oil and it was terrible.
Fair enough. So thank you for the context. I appreciate it. So basically what we're talking about is the vascular tone, I believe, and the blood flow in relationship to healthy versus unhealthy food. So did you use the term reactivity, if I'm not mistaken?
I didn't say it.
Yeah. Okay, but anyway, I think that's what we're talking about is vascular tone and vascular reactivity.
Okay. I mean, I'm just curious, like, do you ever do anything like that with patients?
No,
like
there's no reason to do that because I think we do know that, there are certain offending agents in our food plan that if you so choose, the vascular endothelium, the blood vessels just don't like it, okay? And they react to it. So the blood vessels, like everything else, is a very integrated, interconnected part of our body. And I've often said, Chef AJ, we probably understand about 5% of what's going on in the human body. Honest to goodness, there's so much for us to learn. It is so complicated, particularly in the field, for instance, of cancer and immunology and targeting tumors and this sort of thing. And the aspect of personalized medicine. And for instance, if you had high blood pressure, what is the best blood pressure medicine for you and why versus if I had high blood pressure? We don't know those answers. We kind of know them in broad terms in terms of age, gender, race, but we don't know those answers on an individual basis.
Yeah. Well, no, the reason I brought it up, because if it's true that just eating something like olive oil or McDonald's can impair it, like, wouldn't it be cool, like, if you went to your doctor and like they showed you like right away, you know what I'm saying? Because so many diseases take, when you smoke, you don't get lung cancer right away. But wouldn't it be cool, like, if they could show you right away the effect? Because, when I think about Dr. Clapper, he talked about how he used to be an anesthesiologist. And one time he had to draw the blood himself, like the night before. And it was like just this white, like he actually could see in the test tube, and he asked the patient what he ate, and he said, basically a cheeseburger and things like that. So that's why I brought it up, because
they saw what they call chylomicrons. Let me say this, going back to the exercise echo, patients really resonate with pictures, okay, or data that it personalizes it, and it's objective, and therefore you gain their trust. So I often show my patients their studies, be them either normal or abnormal, and that helps steer the conversation. So you're absolutely right. It's just that what you're describing, that test is not routinely done in outpatient medicine.
Right. They're saying the portfolio diet is research from the same doctor that developed the glycemic index. Really? That would be David Jenkins. Are you sure about that? Because he's been on the show. Yeah, David Jenkins. Okay. Oh yeah, we're gonna ask him what he eats in a day. I told him that's gonna be his very, very last.
Oh boy.
But I saw something that kind of looked urgent about oh, here it is from Brigitte. I get dizzy almost to the point of passing out when I get up from sitting or laying down. What type of doctor to see? Well, one right away, as I would say.
All right. So a couple of things. What is her blood pressure? Number one. Is it lower? What happens when she's sitting versus standing to her blood pressure? What's the change? 2, is she staying hydrated? 3, this might be a circumstance. I know this might be against what you're trying to promote, but this might be a circumstance where she needs to consider liberalizing her salt intake a little bit. There are people who actually are very, can benefit, particularly when they have orthostatic blood pressure change, to liberalizing their salt. She could try some lower extremity compression stockings, but most importantly, before she does any of that, she should consult with her primary care physician and probably get a referral to a cardiologist who specializes in orthostatic hypotension.
Wow, you know, I mean, God, they're really specializing. One in lipids, one in all.
Yes, absolutely.
That's very cool. Well, I guess I should ask the fun question that almost every guest, well, I think every guest get asked. That's why I prefer to have plant-based eaters on the show is what does Dr. Rimmerman eat in a day?
I'm really nervous. This is the toughest question of all. I feel like I'm going to get a report card here.
I thought your looks was fine. I mean, there was nothing in your food that I thought was.
Well, Ezekiel bread, I consider that somewhat processed, to be honest with you.
But I mean, you don't seem to. I'm guessing you probably don't have any health problems. You don't seem to be overweight.
So
I don't feel like bread is like a big sin.
Okay, good. So here's my breakfast, and it's pretty much the same every day. Ezekiel cereal with a cut up banana, with some Ceylon cinnamon, and I know that I don't think you're a nut person, but I put in a little bit of crushed almonds, and then I use the Elmhurst nut milk as well and then I mix 50-50 that with water, and it's less milk and more water. So that is my breakfast. I think I already communicated my lunch, which is typically the Ezekiel sandwich, but not always, and some fruit and some vegetables. And then for dinner, you know, I'm the beneficiary of an outstanding, frankly, an outstanding spouse in many respects, but also someone who's so thoughtful and self-educated in the kitchen. And she has developed a portfolio of recipes that are homegrown that are phenomenal. So when I'm not traveling and she's in town, which is most of the time we're together, it varies, but it's obviously very legume based. It's very vegetable based and grain based. So, you know, and then usually some sort of fruit for dessert. But, you know, frankly, it's just a combination of grains, legumes, vegetables, and fruit in one form or another. But for me to kind of share one singular meal for dinner would be impossible.
Right. That's so cool. Well, you know, I think your diet's pretty good. I would say, like, if I was going to tweak it at all, I would just say you need a little bit more vegetables.
Yeah, you're probably right. I get that more at dinner. And then the other thing is, you know, one of the reasons I use the nuts is I actually, maybe similar to you, I have trouble keeping weight on. And I know your audience probably, a lot of people are jealous when they hear that. But if you're thin to begin with, keeping weight on is also a concern. And you know, you always want a little bit of extra weight for a rainy day.
I have no idea what that's like. That's, you know, I think that's fantastic, you know.
So that's where I've incorporated a little bit more the nuts where I get the calories. But
yeah, I have no problem with other people eating nuts. I know they're very healthy. I just can't do them. But no, I think you're doing great. You look great. Yeah, people are saying you just seem like this wonderful doctor, a lovely person. That's it's nice. Very nice to meet you for sure. I'm sorry I had to.
I if we're against time, I apologize. The only thing I'd say.
Oh no, we can go. Hey, you're the doctor. You've got to work. I can go as long as you want.
There's just only one other topic, and how do we get physicians more on board with this? To be honest with you, because I think we could be doing so much better in the healthcare profession. I find my practice is so inefficient, Chef AJ. I'm meeting one patient at a time, and I'm trying to change their lives. But how do you have a broader impact over a shorter period of time? And I haven't figured that out yet, but I think our professional societies, mine in particular, the American College of Cardiology, the American Heart Association, you know, I'm in the shadows of luminaries like Drs. Esselstyn, Roizen, and others that you've mentioned. These are the gentlemen that I know so well. And I don't think, with all due respect to them, I don't think they've been able to crack the code on this, to be honest. And we're at the tip of an iceberg here. And I've often said, I do a lot of traveling in my job, including international travel. And what I do is I try to stay at a decent hotel, and I actually bring either recipes or food ideas with me. And I meet with the food and beverage manager, and I tell them what my parameters are for eating. So I create a menu at hotels, believe it or not, for myself. And a nicer hotel will do that for you. But not everyone necessarily thinks that way. And I think we can do a lot better. Think about the societal impact we would have in terms of productivity, reduce healthcare costs. These are all things you know. if more people were to get on this plant-based whole food program, we all know what it does for you as an individual and in aggregate what it would do for society's health. But I haven't figured out, even thinking long and hard about it, how to make that domestic or even international impact. And, the momentary enjoyment of eating an ice cream cone, it's momentary. It's not, you can still derive great pleasure from a plant-based whole food program, and the same amount of pleasure that you would from a piece of German chocolate cake. So I often tell my patients it takes a month or two for the brain to convert, for you to adjust your taste buds and your expectations for food. But if you can push through that first month or two, then you're going to be well on your way. But don't give up. Stick with it for the first 1 to 2 months, and it'll be worth it. And you may miss some foods initially, but in the end, when you won't believe, you'll look back and say, I can't believe I used to eat some of that stuff. And again, all about this, the planet and the animals and how these animals are treated and everything else. These are big ideas, big thoughts without clear solutions, but they're certainly on my mind. And I think more healthcare providers need to get on board and continue to spread the message. So those are my closing thoughts. Sorry if it was a bit rambling.
No,
I'm passionate about it. And in my lifetime, I'd love to see an improvement.
But now you got me wondering, you mentioned what your job is at the Cleveland Clinic. What is your specific job there other than being a cardiologist?
So I'm something called Chairman of International Operations. And the Cleveland Clinic, briefly, we're over 75,000 caregivers. A caregiver is an employee. We have about 12 hospitals in the greater Cleveland area, 5 in South Florida, a brain health center in Las Vegas, two outpatient facilities in Toronto. We have a hospital in London, England, with an outpatient facility, and we have a large hospital in Abu Dhabi, the United Arab Emirates. And we also do a fair amount of consulting and advising around the world, internationally. So it's my responsibility to oversee a large part of our international portfolio and our growth for Cleveland Clinic. So today's one of the days where I'm not seeing patients, so that's why I'm wearing a suit. But we typically wear lab coats when we're seeing patients. So I have a very, very interesting job. I'm very blessed because I get to mix the healthcare aspect of things with the business aspects of things. And I get to meet wonderful people around the world.
That's so great. Sherry wants to know, do you ever go to any of the conferences like the ACLM conference?
No, I've never been to any of those conferences, to be honest. My wife is board certified in the lifestyle medicine, American Board of Lifestyle Medicine, but I've not done that. I'm not sure where I would find the professional bandwidth to start getting more deeply involved. So where my level of involvement is, it fits into what else I'm doing in my life, both personally and professionally right now. But I'm just so grateful that you've given me the opportunity to spend some time with you, Chef AJ, because I wouldn't be here without my wife. And hopefully I made a difference for a few of your listeners. I sure hope so.
Well, you've been wonderful. And I have a new idea for you. I've had cardiologists on before, plant-based cardiologists that are involved in something called Walk with the Doc.
Oh, yes.
It's a national program, and some are involved with something called Dine with the Doc.
Yes.
Let's do Row with the Doc.
All right. Well, that's a pretty good idea. You'd probably have to have a bigger expert than me. Maybe Dr. Esselstyn will do it.
But we could even do it virtually, because like you and me, we could be on Zoom together.
Oh my God. Okay.
Wouldn't that be kind of cool?
Well, yeah, it would be cool. I just got to figure out when, and with the time zone too, right?
Yeah, but anyway, just an idea, because I don't think anybody's done it yet. Row with the Doc.
I'm familiar with Walk with the Doc. That may have actually started in Columbus, Ohio. I could be wrong.
Yeah, because I've had several cardiologists that do that. And then a Dine with the Doc was the wonderful doctor. Oh my gosh, when I have to think of names, I had him on recently, a wonderful doctor from, I don't like when this happens, but he does Dine with the Doc, where they bring people in. So now we're going to have Row with the Doc.
All right. Well, good.
Okay.
Well, listen, thanks so much.
Hey, thank you so much. It was such a pleasure, Dr.
Thanks for what you do. Take care.
My pleasure.
Bye-bye.
And thank you. And thanks all of you for watching another episode of Chef AJ Live. Please come back tomorrow when the show is at 10 a.m. And my guest is the author of The Hungry Brain, Dr. Stephen Guillenet. Take care, everyone.